dietitian, Fort Collins, Colorado. Where you're located, student, nurse, therapist, dietitian, what have you. And Pittsburgh, I love finding out where people are. This is so great. Hayes dietitian, Denver, Virginia, Texas, Kansas. Oh my gosh, California, you guys. We're all over the place. Oregon. That's cool. Well, and now Vegas, y'all, this is fantastic. Now we know a little bit about you, so thanks so much. That was awesome. Wow, okay, sorry. Yep. Thanks, guys. I appreciate that. And we have a couple, again, throughout the presentation, so just keep your phone handy, and we'll just, we'll prompt you when it's time for that. So there you go.
Okay, so my name is Jamie, she, her, hers pronouns. Just want to start by saying that thank you for joining us, and we are so glad you are here. We're beyond thrilled to have this large conversation and to continue this conversation. And me personally, I'm very grateful and humbled to have this opportunity to work alongside with this presentation and have this conversation and be part of this talk today with these amazing clinicians, Allison and Taylor, as a forever learning and growing ally. To start this conversation off with you all today, we want to start by speaking to the importance of starting this conversation with your clients. Now, personally, I love body image work and something I love to talk about, and I'm continuing to learn and grow in that area, as we all are. But body image is a very complex, nuanced, and difficult conversation working with our clients. There's so much to it. And relationship with body has a huge part in everyone's recovery journey and in everyone's life. But as clinicians, we don't have any formal training when it comes to body image. I think I speak for everyone when I say that we haven't had that in our training, and we have to seek those opportunities and supervisions on our own after graduation, right? So oftentimes body image comes up as this, can be considered kind of like, we view it as this elephant in the room, something we're timid to approach, and it's this big thing, but we're unaware of how we should be approaching it or how we should be talking about it. And everyone probably feels differently about this, but I know that I have felt this way and continue to feel this way in certain areas. So sometimes it's then the hot potato as well, where it's passed off from clinician to clinician of, right now we're going to focus on this and later we'll focus on body image, and it's passed along to other clinicians in recovery, in that individual's recovery journey. And that's harmful. It's definitely not helpful. So, and it's really important for our clients to talk about and consistently talk about. So with starting the conversation today, I'm just really excited about having this open discussion about how to approach body image work with our clients, and with our clients of all identities and experiences, and the intersecting roles of the treatment team with this discussion.
Another QR code. So again, hover over the QR, and for this, just write down any words or phrases or whatever that you associate with body image. What is body image? It can be short, it can be quick. Also, it's all anonymous, so it won't say Taylor said, I don't know body image. It won't say that at all. So just totally feel free to be as open as possible. We got body hate, complicated, how you feel in your body. I'm just going to read some. A relationship. Ooh, these are good. Y'all are quick. The way we think about our bodies, feel in our body, number doesn't define you, ever evolving, stereotypes, awareness, confidence, acceptance, embodiment. Yeah, nice. Okay. Body dysmorphia. Y'all can all see as it posts too, y'all can see these as well if you want to know what your peers think. Difficult to discuss as an RD without feeling outside the scope of practice. Yes. I'm not a dietitian, but yes, from what I know about dietitians, and as a therapist, when Jamie was talking about that hot potato, I remember working at higher levels of care and be like, you're going to work body image on outpatient level. Right now, we're not going to do that. We're just going to talk about other things. And it's difficult as therapists and dietitians, I imagine. Okay. Thank you for all your feedback. Patriarchy. Ooh, I like that one.
My society and culture.
Culture.
Yeah.
Oh, social constructs. Ooh, this is good. Good stuff. Thanks, y'all.
Yeah. These are awesome. So continuing with what Jamie was saying in like starting this conversation. So in working with transgender nonconforming folks, in preparing for this presentation, asking my clients who are transgender nonconforming, the number one thing that they said was the importance of providing a safe and inclusive space. So what does that look like? It's building the relationship, right? So providing like a trusting, non-judgmental space, and using that trauma-informed approach, even if there's no overt trauma, but approaching with curiosity in terms of like, is it okay if I ask about XYZ? Because body image is so complex. So making sure that it is client-led and you're ongoing with building awareness. And then it's also super important to make sure you're doing continuing education, like being here. So thank you all so much for being here. And with that continuing education, it's really about examining any internal biases, privileges, where you may fall short, even if you're not realizing it. And that includes everyone, myself included. So on the next slide, Allison's going to talk about some things to kind of like put in check, keep your ears, eyes open for.
Yep. Thanks, Taylor. So things we want to keep in mind while we do this presentation and while we work with all clients, especially clients who their gender identity differs from ours, right, is our privilege and our bias. And this can be a whole talk by itself. And so just to like give you the basics, if you will, being cisgender has certain privilege and certain privileges that come just by default, right? And so you can see some examples. And I'm cisgender, and so I've never had to worry about physical safety based on my gender identity. You know what I mean? Because I am cis, and never had to worry about like medical care, access to medical care, and or being hired or fired based on gender identity and all that. So we want to just make sure we check ourselves and know that we have to educate, right, all the time. We have to stay in check with ourselves and in check with the transgender world, just to make sure like we stay on top of it. And then my other thing is like this rapport building thing. I say this a lot, I think, with sometimes you will have a trans client, LGBTQ client, gay client, what have you, as a client, and they are seeing you that is nothing related to that, their sexual orientation or gender identity. And so we don't have to make it all about that all the time. You know what I mean? And be appropriate with your questions, be appropriate with your exploration. And you'll hear this throughout the thing. Respect name, respect pronouns. That gives a great foundation, right, to work with our transgender clients. And I love this. And dietitians, there's a lot of y'all in here. Ask the client if certain words would help, because I know like our dietitians have to do, like your assessment, your first thing, and it can be some medical questions. So like, do you prefer the words menstrual cycle, period? Do you prefer chest? Do you like that kind of thing? Can be super helpful as well. Also, there's a nurse on here too, so well done you. Yeah, thanks.
Yeah, and asking those things can be really show that you're ally, like, because ally is like, I'll say this over and over until I'm blue in the face, but ally is a verb, it's not a noun. So doing things like that is really where that allyship comes into play and shows that you're a very safe person. And so as Allison was talking about all these cis privileges, like as a trans person, I have had to worry about a lot of these. And I'm white, so I have privilege in that way. So a lot of, people of color in the BIPOC community, like they have to worry a lot more. And it's just, there's so many levels of this. So in kind of continuing the conversation with clients, it's continuing to assess safety, and readiness in doing the image work. So I'm sure a lot of you have heard of like the subjective units of distress and the window of tolerance. So staying within that window of tolerance, but just kind of working to kind of push it a little, but not constantly being in that state of fight or flight. Um, and then how do we bring our own bodies and experiences into the room, and recognize those different privileges that we just talked about? So question I get a lot is, as a cis provider, how do you work with a trans client, and make that comfortable? Because there, maybe some pushback of like, okay, well, you don't know what I'm going through, so there's just this block, especially when you have this eating disorder on top of that. Um, so things to kind of normalize would be like, introduce yourself with your pronouns. So I find a lot of times people just kind of assume, and something that I was talking about yesterday was not assuming. But anyways, um, but like, can you go an entire day with not assuming someone's pronouns? Like, can you go to the zoo, for example, and not gender any of the animals? Like, can you do that? And so practicing throughout your entire like at your day, and just normalizing like, hi, I'm Taylor, my pronouns are he, him, or they, them. Hi, I'm Jamie, my pronouns are she, her, and just really normalizing that, because this signals that, hey, this is a safe person. And so really, adapting, and I say that adapting, but really just normalizing. And so making sure it's client led, and then really assessing your fit with the client, and abilities. And so comfort level, any gaps, and really addressing that treatment gap. And if you're not sure what that is, go look that up, because it is pretty big. And then continuing education and, supervision. Getting supervision is always an amazing thing. So that ability and comfort level, is definitely really important. And I think on the next slide, Allison's going to talk about clients that in the alumni group, and some of their experiences.
Yeah. So I work a lot with the alumni of Balsada, obviously, and so I polled the audience, and got their permission to use their quotes, because I think it can be really powerful to hear directly from clients who experience this. And so I pulled some great ones that I just have to read them because they're just fabulous. So 25 years old, identifies as non-binary, feels like there's no space to be in a larger body. The world kind of presents it as like this thin, androgynous body to be in the non-binary. It feels like there isn't a space for my body to exist. There's also, I was talking with this client, and they said a lot of, there's a pressure, at least in their world, to be non-binary enough, and like, this is what you should look like as non-binary. This is what your body size should be as non-binary, and like this pressure to like fit the non-binary mold. And it's just an interesting thing to think of when you work with clients who identify as non-binary. There is this like pressure to be this like small body with no gendered features for some of the clients. And then a 35 years old trans man. So one of the questions I asked was like, does your gender identity and expression impact like dating and relationships and romantic relationships? And he said, well, you can see, only dates cis women and trans men, so doesn't have to worry about being grossed out or that I'm in a larger body. He would say like he felt unsafe around cis men, and felt like his body needed to be like muscular in tone and, you know, like cis man, all that. So I just really appreciate the authenticity with the alumni who talked about how their body image, how their gender identity impacts their body image. And it goes into different buckets than maybe we even think of, like relationships and pairing off romantically or what have you. And then feeling like you fit in or not. Things to think about. Oh, so I love a research. Not a lot of people like love a research, but and so I wanted to throw in some things from some journal articles, if you will. And basically what they say is, yes, trans individuals and or genderqueer and or depending on the journal, how they use the wording, have higher rates of negative body image and eating disorder pathology, which makes sense if you think about your clientele, if you're an outpatient or in a higher level of care, think about your group of, I don't know, you see 30 clients a week, I have no idea. And think of how many roughly identify as LGBTQ and or identify as transgender, non-binary. Another thing that was interesting was this article down here. It looked at gender expression, not gender identity, but gender expression. And it found that masculine traits, masculine presentation was less body dissatisfaction and feminine traits was more body dissatisfaction. I point this out because I also want to be aware of stereotypes. And to me, it's kind of I think it's a stereotype. It's like, oh, so masculine, don't need to worry about body image, eating disorder, feminine, that's what I need to worry about. So yes, in this study it said that, but also I think that can be harmful, if we keep that in our heads all the time, regardless of gender identity, just that gender expression part. But I did want to point that out there because it was interesting. So, there
you go. Okay, so now that we kind of chatted about brought some experiences in, we're going to start getting into some of the meat of the presentation as far as some concepts we want you to take away or to start having the conversation around. So gender and body image and things to consider. As clinicians who work with eating disorders and just with humans, we have a responsibility to all our clients to be part of these conversations, to elevate and support the marginalized voices, continue our education, continue our supervision, continue in examining our own biases, and I'll strive to continue to pursue to keep doing better at providing an inclusive and safe space for those marginalized populations and for all clients so that they have the ability to explore body image and recovery in our office if they want to and to the extent that they feel comfortable. So as we dive into this, we want everyone to think about how you, as someone who is working with eating disorders, are already working with body image with your clients. What are your current practices? How do you approach it? Where is your comfort level with it? And where do you feel like you have some gaps or don't feel comfortable or need further supervision and guidance with body image work?
Another QR code. So again, just hover over the QR code and tell us how, if so, do you adapt body image work with non-cisgender clients? So transgender, non-binary, and just tell us your thoughts. Also tell us like, oh, I don't know, and or whatever, all anonymous, so just feel free to type away. Hoping to learn. That's why I'm here about this training. Okay, pressure's on. Okay. Ask a lot of questions to try to understand their lived experience, making sure I'm not making assumptions. New to this, don't want to mess up. I really feel lost in this. Let the client lead, ask what language feels appropriate. Going over the process of gender affirmation procedures with their particular insurance. Yeah, feeling pulled to say that I don't feel the work changes much because it's an approach we should take with everyone. Oh, okay, excellent. Provide educational binders, right. Okay. So a lot, bring in intersection of fat phobia across the gender spectrum at largely, the box is moved, at large and within queer society. Y'all, well done. Okay.
Yeah.
Thanks. So a lot of us are, this is why I'm here, which is great. Well done. And I like, avoiding body acceptance talk. Talk about expression through clothing. Oh, this is good. Okay. I'll move on. But that, I like y'all's feedback. Thank you. Oh, me again. So yeah, things to consider with body image and gender identity, gender expression that maybe we don't think about a lot with cis clients. And this is not every cis client will say these things and not every trans client will say these things. So, but just the different like masculine skull, right? Bigger brow line that sticks out, bigger jaw line. These are things that surgery can help. And how do we work on that with our client, right? How do we talk about that? The shoulders, hips, the waist, the structure, skeletal structure, is that a word? Are different. And so that's something we have to think about in a different lens, I guess. Also body hair. So think about, body hair being all over the body, the face, the hair, and or I don't want that all over the body or the face. So that's something else we can look at and explore and not play with, but like, okay, so try shaving your legs and see how that feels, or opposite, don't shave your legs and see how that feels. You know, I wrote down gait and sitting. So gait, like how you walk, and how you sit in a chair, you know, and it's so stereotypical that like women cross their legs and blah, 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 whatever. But this can be important for our trans clients because they have to pass, and I always and they want to pass, and for safety reasons, right? And so working on different areas that we're not necessarily thinking about, I think could be really important, and just sort of exploring this with them, you know.
Okay, so we're going to dive into 4 concepts today more thoroughly. And this is an extremely large conversation. When we were all working on this presentation, I mean, it was very difficult because this is just such a huge topic that we need to keep talking about. And so we took the presentation from like probably what could have been 10 hours and decided on these 4 concepts. So these are not all inclusive by any means, and we hope to provide you some tools and just like a deeper conversation with some of these, although it's still going to be just touching the tip of the iceberg here. The 4 concepts we're going to go over are body checking behaviors, how and when to bring in the science and research into our sessions with our clients, exploring body image expectations and the body image journey with our clients and like what that looks like, what that means, and helping clients build body trust. Okay, so the first of the 4 here is body checking. All of you might be familiar with body checking. I'm sure you all are to a certain degree. And body checking, so what it is, the definition of body checking is it's referring to an obsessive thought and behavior about appearance, usually used to judge, critique, control, and or understand the body. And it can present in a variety of different pervasive ways for our clients, from hopping on the scale, obsessively looking in the mirror, pinching, asking for reassurance, a lot of different ways, as well as it shows up in different ways. And also the purpose of it is different for every client and it varies. And oftentimes, and what I find is clients don't know don't necessarily know the purpose of body checking, and they're also not very, they may not be aware of how it's impacting their eating disorder behaviors, or themselves in general. So many times I see it in my office as like this automatic behavior that's like unconscious. And I think a lot of our work is providing a safe space for our clients to raise awareness around these things that they may not have as awareness on, or a deeper awareness that might be helpful for their recovery journey. So with body checking, and I pulled from the research here, and that you can see here if you want to take a look at that. But the belief for many clients is that body checking is going to provide some kind of relief or decrease anxiety or worry, or help them to feel more in control. And so we need to talk about this as clinicians with our clients, because it directly impacts what we are working with our clients with their relationship with food, with their relationship with body. As a dietitian, working on feeling safety with their ability to do their meal plan or to move away from their meal plan and trust their body. Body checking behaviors are going to directly impact that. And so, as you see, again, pulled from the research, I created this infographic to depict the research that I pulled, and it shows how body checking fuels and maintains the eating disorder and eating disorder behaviors. So the model shows that when responding to negative emotions, body checking is performed in order to reduce the aversive state, and consequently the effect of body checking to stop the negative emotions just reinforces and maintains that checking behavior. So it can be assumed that body checking is maintained through negative reinforcement. And even to note, like, when going to higher level of care, and I've never worked in a higher level of care or been able to have that experience, but oftentimes, like, when the clients have to stop using certain behaviors, or those things are monitored or taken away to interrupt those behaviors, but body checking is always there. And clients are always going to continue to do that, and may not be aware. I shouldn't say always. A lot of our clients, and we're just not. It's important to raise attention around it because it affects the other behaviors. So, lastly, here, the slide is titled "Body Checking: A Behavior That Needs to Be Addressed," and there was a reason for this. And the reason is because there is body checking that is an eating disorder behavior and maintains the eating disorder. And there is also body checking that is the person and not an eating disorder behavior. And we need to be able to explore and suss out with the client their experience with body checking and the purpose it serves and why it's there, and just their experience with it.
So thinking about body checking as an eating disorder behavior or a function of gender dysphoria. So briefly, what is gender dysphoria? It's the distress felt from the incongruence between one's gender identity and the sex they were assigned at birth. And I put this little picture here because it's there's really no way to say, like, there's no really quote right way to have dysphoria. And just because someone is transgender nonconforming doesn't mean that they have to have dysphoria. And so policing that really is not right. But it also, like, with someone with both who is trans and has an eating disorder, it kind of can be like a chicken and an egg scenario, and that can be a lot of like overlap. So when you're some examples would be like, oftentimes with an eating disorder, we see the stomach being really a focus of that eating disorder and body checking. So like checking to see if the stomach is flat, if it's going out, if it's going in. And an example of like body checking for dysphoria would be like, checking to see like, okay, is my facial hair coming in, going away? And then an example of where that overlap would be like maybe the chest. Is my chest like going down, for example, as I lose weight. And the weight loss itself could be a function of both the eating disorder and a way to modify the body to have that gender presentation being more in line with the gender identity. And so that's where that overlap happens, and sussing out where the person is and where the eating disorder is can be so hard because of that, entanglement. Um, so really, again, it's approaching with that trauma informed lens, even if there is no overt trauma, but just asking with permission, say, is it okay if we talk about this? Do you want to talk about this? How do you feel about talking about XYZ? And really not making the client educate you on trans body issues, but really asking about their gender identity, and working to suss that out and really be attuned with your client. And that's building that relationship is so important um, within that. So on the next couple slides, I've put some artistic renderings of different folks' gender dysphoria. The one on the left is more of external, what folks have said to this person, and how that affects them. And then the one on the right is a depiction of more of their body. You've got like their dysphoria in terms of their height, their big feet, their voice, their hair, their balding. And then if you want to move to the next slide, just some more depictions of dysphoria. And the one with the bathroom is like, it's 2021 and we're still dealing with this, but like this one hits home even to me because I don't use the bathroom in public anymore because of this. And it just sucks. It's like, just being aware of this and providing, inclusive spaces can really make all the difference in lessening that so you can do the eating disorder work. And so some interventions Allison's going to talk about next.
Sure thing. Let me first say, like, I try to never get in a power struggle. I'm sure you all do too, with clients. And so for me, it's not going to be a black and white, like stop the body checking, continue body checking, right? And so I'm going to try to find something in the middle where I just sort of lessen it and lessen it and lessen it. And also, like, therapeutically and dietitianally, I'm making up that word, what is the function? Like we were talking about earlier, like what is the function of the body checking? And so figure the function and what needs are met by that. And so if we can catch it and acknowledge it in the moment, well done, that's step one. Sometimes we can't even, know that we're doing it because it's just so engraved, right? And then obviously there are like distraction things, keep your hands busy, work on a puzzle, all these like coping skills. I like setting time limits. So this would be maybe for a client who every morning, the part of their routine is to stand in front of the mirror for X amount of time, average, or maybe they know, about 30 minutes, I stand in front of the mirror and do my routine of body checking. I start here, I go all the way down, do the things, change clothes. Okay, what if we tried 25 minutes? Well, let's see what happens. And then continue to gradually decrease that and see if that helps, what comes up emotionally. Does it play out in other areas during the day? Do you have to make up for that later? Because I think like one of my mentors in life told me that like the time limit thing, and she was just like, I mean, you could be hanging out with your friends or walking your dog, like, but instead here we are 30 minutes of your day, your waking hours, and we're here criticizing every part of us, kind of thing. So I like the set time limits. Gender props will be in a minute. I'll show some examples of the gender props. One time this clinician called and had a client who identified as transgender and was not taking showers avoid it, right? Because, and we hear this, you know, because you're fully exposed, you don't want to see your whole self, you have to like touch your whole self to shower, to bathe, and there's the mirror probably in the bathroom, so you see that. And so we were just sort of bouncing around ideas to try to help client wants to shower, you know, client's like, I know I need to, all these things. And so we were bouncing around ideas to like sort of help it, almost exposure work. And so like we thought of, okay, covering the mirror. What if you wore a bathing suit? What if you played music? What if you turn the lights off? What, you know, just do all these things where it could be more comfortable getting in shower, and then we can maybe work our way down without these added things. That's a thingamabob, technical term. I was working with the alumni, not related to gender identity, and we were talking about the fear of the shower and the body image and all that stuff. And I think a lot of times we think, oh, okay, so let's take away things. So let's block mirrors, which is fine. And so I was talking to them and I was like, I personally, Allison in real life, I play Kesha. It's fun. I hate showering because I think it's a waste of time. I'm a 7 on the Enneagram. I get bored, so I have to make it entertaining. So I play music. I also have a fun lighting thing that makes it very exciting. So how can we make it better while not avoiding all of it? I hope that makes sense. Okay. And then the next one, I'll show you some gender props and cues. And so this can be helpful, again, with the exploration piece and or helpful with body image, body checking, depression, anxiety, all these things. So it's anything that we use to express our gender, right? And the binary approach, if you will, of like there's masculine props and there's feminine props. When I say, I'm using quotes if you can't see my head and I'm bobbing it around a lot. And I also like to point out that over time, gender props have shifted genders. My examples, men used to wear heels to be taller. Red used to be a color for men. Men still wear wigs in British Parliament, and da 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 da. So women wear ties now. You know, it's all shifting. So I'm not. Please don't hear me say like, oh, there's this binary thing about gender props. I'm not saying that. I'm just saying. Anyway, so this can be helpful with all the things. And I had a client once who was in an exploration stage of not really sure the gender, and it was winter time, so they could wear pants. So sex assigned at birth, female, identified as unsure, non-binary, man, we don't know. And so they grew out their hair leg and felt safe enough to do it because they could wear pants to work and not feel judgment or what have you. And so that was something they explored with. They didn't shave their legs, they didn't shave their underarms. It was just something to help, you know, step into that role in a safe way for them. They would shop in the men's section just to see how that would feel, to see what that, you know, experience is like putting on jeans for men and, you know, all that thing. So gender props and cues can be a creative way for the client to feel good to see what feels good to them, kind of thing. Also, this voice thing at the bottom, I believe, Taylor, correct me if I'm wrong, there are apps maybe that you can work on shifting your voice to higher or lower to help with that feminine voice, masculine voice type situation. Just to throw that out there. There's tons of resources, voice coaches, well done, and so we can send out a whole bunch of resources if you need when we send out the PowerPoint. There you go. Oh yes, binders. Taylor, tell everybody about that cool resource for binders. But first, so binders are great things to buy, like Taylor was mentioning earlier about, let's say you have a client who is weight restoring and chest might get larger. So, and client identifies as man, so doesn't want a chest, right? And so binders can be a great way to have that flat chest appearance, to be able to wear button ups and it not, you know, do the outline or what have you. They might come in different shapes and colors and skin tones and all of these things. One thing, try to encourage your client not to use duct tape. Some binders can be expensive. Taylor has a solution for this, but duct tape can be very painful, obviously, and hurt your skin.
Yeah, no duct tape, no ace bandages, no saran wrap, or I've seen so many different things that are like physically damaging. And then like with binders, it's can be just kind of like exploring and being aware of with your client. There's so many different types, like the tri-top, which you see in most of these here. And then sometimes can be like full length too. So they can function as like multi uh multifunctional in that like some of the full length ones will kind of like hug your body. So if there's like some trauma around that, it can be like neuro functional too in that term. So it like can be like a weight, like wearing a weighted blanket, so to speak. Um, but also being aware of, oh, that can create a flat chest. So just kind of figuring out like where the line is between like the dysphoria and the eating disorder and the body image and being appropriate for that. And there's a binder exchange program. So like when clients either get top surgery or change sizes within the trans community, they just swap binders. And we can put that link within the presentation as well.
Yeah. And I like to, the exchange program is new to me, so I think that's fantastic, because I like to ruin the surprise. That's terrible. Not ruin the surprise. Take out the surprises. Sorry. Like, okay, client. So making up things. 65% of your ideal body weight. You know, also I'm not a dietitian. I don't believe in ideal body weight. Just go with me on this. So part of weight restoration, changes in your body may occur. So right now you're making up an extra small binder. So let's go ahead and maybe prepare in advance for additional sizes. In higher levels of care, we have like different sizes available in case, you know, someone needs it, what have you. They're not out, they can't buy it on their own, what have you. So I was just like, this might happen, so let's just go ahead and prepare for it, kind of thing. People are just sending in resources left and right.
Yes, awesome. Thank you.
And Mandy told me not to look at the chat. Sorry, Mandy.
I know it's hard.
It is hard. So other things that can be helpful for clients would be tuckers. And so again, you want to buy tuckers that are made for this purpose. No duct tape, no, well, a bandage, nothing. Like duct that could be very damaging to the skin, body parts, etc. So this can help with feeling with feeling that the penis is not there or it's smaller, maybe even like in tighter clothes, it can tuck and you maybe not see it on the outline. So again, good for body exploration or gender exploration, good for clients to help with their gender identity, body image. I'm going to coin that phrase one day, but it's still a work in progress. Another thing, and this is great. Stand-to-pee devices, that's what STP stands for. So think about if you're going to the restroom and I am assigned female at birth and I want to use a urinal, but I can't. So I have to go in the stall and my feet face a certain direction, right? Well, that's outing me right then and there, right? But I really want to be able to stand facing the toilet and or the urinal, what have you. So you can stand-to-pee devices. Sorry, I get excited. And so you see they come in a variety of different skin colors, what have you. So that can help bathroom safety. That can help body image. You can also get packers, which you don't use the restroom through. I don't know if you've ever had a presentation where we say pee so much, but here we are, stand-to-pee. I just realized I'm saying that a lot. And you can also just buy packers where you don't use the restroom through them, but that can help, again, body image exploration, all the things. So.
Okay, so the next concept that we're going to speak on is presenting science and research and the gray of this. So as dietitians, we talk a lot about science and research, and we use it in our work in a really proud way. We're evidence-based practitioners, and we can geek out on this. And it's very, very helpful for our clients to dispel myths, to educate around different concepts in recovery, from weight science to health at every size, intersection of health and weight, health science, nutrition science, so many of the sciences. And at the same time, so one thing that I thought was important, that we thought was important to talk about when we're talking about presenting the science is, and what I'd like everyone to kind of think about with your experience with clients, or maybe just imagine if you haven't had this experience, but when can presenting education and the research and the science be unhelpful or untimely or even harmful? And I wish we had a QR code for this one, but we don't. So we'll go into some examples with that. But considerations when we're working with the research and the science. So it's a huge role, and we have to approach it very carefully and use a harm reduction or harm minimization model, because first and foremost, we need to first do no harm as clinicians. So it's important to consistently assess when, how, and why we are educating, and how to educate. We have to think about the impact it will have on our client. What's our intent with presenting the science? How will it be received from the client and impact your work with the client? What is the best way to present this? How is, knowing your client, what's the best way to present this, which is again where the foundation here is having a rapport with your client and taking that time to build that rapport and really know your client, and to provide a safe space to do so. So you have to think about what is the best way to present, using all of these things that we put there, and also considering client autonomy and choice in this as well, so that they can feel safe in the work you're doing. If they don't feel like they have autonomy in this, in even what the education is, that can feel very unsafe. And then also a very important thing to note is that we want to consider if we're killing that human connection with the science, and the importance of listening to their story and their human experience as humans together in the room, rather than like fixing with the science, because this can ultimately just push you two further apart, which is then not helping the client and is harming the client if that's their experience in recovery, maybe their first experience in recovery, who knows. So we really want to first assess and do no harm. And that also means like practicing ourselves as well, like being open and honest and transparent and vulnerable as clinicians. So by continuing to grow and be uncomfortable and get uncomfortable. So one example I wanted to bring up, and I'll bring up really quickly here because as I knew it's gone so fast, is that one of the experiences that I have a lot is with clients in larger bodies, who, and I'm thinking of one in particular who has, been dieting their whole life, and they're, not ready to give that up, and presenting on weight cycling and health at every size and what happens with an intentional weight loss and how that affects your body. That can feel very unsafe and hopeless for people. And then they don't have the opportunity to explore where they're at, which can also be invalidating. So we have to think about if we're being HAES informed or health at every size informed or health at every size dogmatic, and then kind of replacing their eating disorder thoughts or misconceptions or what have you with, our own agenda. So we have to be careful because that can really push people away from like just feeling safe while working with you in your office. So another example here really quickly is just like when we are again presenting like the research or the science or the history or the concepts of you know, the ideal body for with our clients, we have to be conscious not to assume what ideal that is, because that's going to be different for every single client. There are many different ideals for different clients, and specifically, and we'll chat about this in a second, Taylor's going to chat about this, but there's also varying degrees of ideals for different subcultures in the LGBTQ community, and it's important to just not assume.
Yeah, assumptions can definitely be harmful. And so I think with health at every size, and speaking to that, like practice versus it's with working with trans folks, like sometimes we have a lot of times, who am I kidding? We went up with like BMI cutoffs for any surgical um, interventions. And that can be due to a number of different things, whether that's oftentimes insurance or supposed anesthesiological risks. But research is coming out that the risk is a lot lower than it really is, so to speak. And yeah, I love reading the research on that. But there's also the myth, like I see so many folks come through who are just like so focused on wanting to lose weight for better surgical outcomes. And I think more education, more advocacy needs to be done on the skill of the surgeon and putting that back on them, because that really has more to do with the surgical outcomes and the size of the body. And because every body is different, everybody is unique, and that's really a fact of life. And then speaking to like HRT, just testosterone, estrogen, estradiol, and hormone receptors, they really need fat for function. So with restriction, weight loss, in eating disorders, those hormones are going to be less effective. And and that goes across with trans folks and cis folks. And so that just really, for going back to the science on that can be helpful, and maybe not so helpful, but it really is, getting to a healthy weight, to make that more functional, essentially. And then so with HRT and any trans folks that do want to be on HRT, so really going back to the WPATH standards, so the World Professional Association for Transgender Health, and looking at timelines, because it's varied on what changes, and we'll provide a handout with those at the end of this as well, so you can kind of look through that and to help with any metabolic changes, anything like that, and any mental changes, because I know as like within the trans community, like myself included, we just want it to be instant. And the thing is, it takes, years. It can take, 2 to 5 years for all those effects to really take full effect. And it can be frustrating to wait. So working on that while working on like the body image, it can be really helpful in like understanding that. And so kind of like Jamie said too, we think about like the thin ideal is kind of the standard narrative in like the eating disorder community and recovery. But a lot of times with my clients, I see that not always being the case. Like it is in some. I don't want to negate that completely. But like as folks either lose weight, restore weight, sort of like identity shift. It's like, okay, I'm in a larger body and I'm non-binary. am I legitimate? Like, what are my role models? Where do I look? Or am I changing? Like, am I no longer this, like a twink ideal? Or do I fit into a, more bare? Where am I? Where do I fit? And so working on that in the body image and is just going to be so important. So I think next we're going to talk about like expectations around that and body image.
Okay, so the third concept we want to explore is exploring body image expectations and the body image journey with our clients consistently, and like what that's comprised of, and the expectations that our clients have, and navigate that with our clients. So actually like speaking to that. So to get us, and this isn't going to be a QR code, but if everyone can think about, when thinking about our clients' body image journeys and destinations, what are the goals and expectations that we have or hope for our clients? Okay, so this was a really hard slide to create. It was very difficult. We're trying really hard to create a slide that was going to like create this perfect way to depict this hugely complex representation of someone's relationship with their body and their body image journey. And we couldn't do it. It's very hard because the nature of body image work is that it's nonlinear, it's messy, it's super individualized. We can be in 2 spots at once, 3 spots at once. It's just extremely complex. And it's a forever journey. We will always have our body. We will always have this growing and changing relationship with our body. And it's really this journey versus this simplistic timeline, which I totally have used. And it is very like invalidating, and it's not a timeline, right? It is very much a journey. It looks different for everyone. So the important part of talking about like the journey specifically, like saying, this is like, what do you think about your body image journey? What do you think about what that's going to look like and your expectations, is because it's important to explore this because it is impacting the way they explore their body image. So the important part of the work as clinicians is we need to create a safe space first and foremost, and a safe relationship to explore this and work with the team to do so. And it's important to speak to the nature of this work because clients sometimes, oftentimes have this belief of what it's going to look like, and that can impact their journey and their exploration. Just like as in recovery, right? Like recovery should look a certain way, and having that expectation can hold them back when they are, in this place where they're using behaviors again when they haven't used certain behaviors or what have you, and then that can impact their journey. So it's important to speak to that. And some of the education that I do is, talking about how positive body image is not the absence of negative body image. It's not, when we are on the journey, it's not waiting to respect our body and choose to respect our body in all these different ways, like through food and the way we talk to our bodies. We can't wait for that once we stop hating our body. Only once we stop hating our body or disliking our body or are able to tolerate it, right? It's sitting with them with the discomfort of that body hate and holding both of those things, body disrespect and body hate, or being uncomfortable in their body. And it's just helpful to think of it as a relationship. And I think someone put that in the with the QR code, it is a relationship that we're continuing to build and explore, and everyone has a different understanding of this within their own relationship with body, but expecting that it's going to be a range of emotions and ups and downs and changes, and also that it's active work. It's not just it's not passive. It's not going to just improve with recovery of choosing recovery behaviors. It's active work of looking at the relationship with the body, exploring it, it's definitely not passive. So educating clients on that as well, and yeah, holding that safe space and that hope with clients when they don't have it. A lot of times it's us encouraging and supporting that journey, and holding that hope for them when there may be an absence of hope at certain times.
So, oh, so kind of an example with this as someone who is trans, queer, and recovered from an eating disorder. Um, I sometimes, a lot of times, hate my body. And as a clinician, I'm saying that. And I don't think I'm a terrible clinician, but so I use a binder. And with that body hate, then I'm able to move into more like body liberation, which feels so amazing. Um, and be able to tolerate my body more. But then, like at the end of the day, I can take it off, and it's like, okay, we're right back with body hate. So then go to sleep, wake up, do it all over again. And so being in multiple places at once as a trans person, and I think doing that with your trans clients, can be really helpful.
So the word agenda means assignment. Sorry, the agenda is this word we use at Alfana, assignment. This can be helpful with exploration and that the journey of body image with the hate, tolerance, acceptance, that. So a timeline, we all know timelines, when like, oh, let's do a timeline of your life and your eating disorder and all that stuff. But let's add first thoughts and actions and behaviors of related to gender, right? And then we could even we could put the eating disorder as well. And so then that could even help with what is eating disorder body image in quotes and gender body image, and we want to be sure to add gender marker events, which is on the next slide. What's up? Oh, okay. Which would be all about. And thanks for sorry. Yeah, and so with the letters to and from current body to self, and identify gender, however the client uses that language, look for idealization, where they're in the relationship with body image, like the tolerance, acceptance, compassion in those letters, and that can be helpful to see like where they are currently, where they want to be, kind of thing. Okay, yes, Mandy. So these are gender marker events, and these are quotes from my education. We had a panel of trans individuals, all ages, all different seasons of life. And so these are just some examples that you might want, they can put on their timeline, where it's like, my favorite one, because this one was used several times, when I used the friends on a blanket as bangs, right? And then that blanket would be that hair part, right? And so like, I vividly remember doing this at 4 years old and what that felt like and what that was like. So different ways that that they recall and remember their gender marker events.
Okay, so the last concept we want to talk about is helping clients build body trust and how we do that as clinicians. We would want everyone to pause and kind of think about what is body trust, but with time, we're just going to speed right into it. So with building body trust, this is a huge part of our nutrition counseling and eating disorder recovery as a whole, and ways in which we do this as, did we want to do the QR code? Okay, we'll just keep going then. So ways in which we do this with our clients to help build body trust as dietitians is, really with everything we do, from the meal plan to getting off of the meal plan to decreasing behaviors that feel safe to weight restoration to continued weight restoration past what they may have been, what the range might have been, and to be comfortable and trust their body with that, to listening to hunger cues, listening to cues, getting like in touch with their body. So we're consistently building body trust, which then leads to more body acceptance and more body appreciation. And so our role again as providers is providing the safe and supportive space to navigate their experience, their willingness, their fear around doing these things, and sitting with the uncomfortable with them of exploring this trust. and again, holding hope for them. So things to consider with this as well is we want clients not to need us. So oftentimes, I experience this so much of like wanting this reassurance and safety with exploring the relationship with food. And like, is this okay? Is this much okay? Is doing this okay? And we really want them to not need us. So we really want to sit alongside them and encourage them to sit with that uncomfortable, to have that experience, rather than reassuring or but putting it back on them. So we're sitting alongside of them on the passenger seat so that like we can get out of the car. We don't always have to stay in the car, but they're still driving and having those experiences. And we're just sitting with them with that. And there's a lot of barriers, of course, to body trust. And some of these barriers are chronic diseases, trauma, which many of our clients experience, and also for our transgender and non-conforming clients, being born in a body that doesn't align with who they feel they are.
Thanks, Jamie. So, Mandy, if you want to advance it to building body trust with transgender non-conforming clients, awesome. Thank you. So, building body trust with transgender non-conforming clients is really about sussing out the eating disorder versus the person, which we do a lot within eating disorder work. Is what's the eating disorder versus the person. So it's similar concept, and so it's definitely number one, providing a safe space again, and don't making your clients educate you on trans body issues, but what is their body issue. And I think there's two components, the mental and the physical. So it is, holding a level of mistrust with the dysphoria if that client has it. And a lot of times I tell my clients, who come in with like just not as much hope, and it breaks my heart. So, I was just like, okay, I'll hold that hope for you until you're able to, because I think that's something that is needed. It really needed, because there's just so many things, coming in, so many issues. And so with that, it's really looking at intersectionality of that client's goals, their experience, their autonomy, and then realistic expectations in the context of eating disorders and any transition that they may be doing. And so really going back to what are those realistic expectations, and doing that in a safe and supportive environment, and looking at any change in perception. If you have a client that comes in and says, okay, my pronouns are now they, them, awesome, moving on and continuing to do that work versus like making them completely, this is this like huge thing. Doesn't have to be. And then connection with other community members. So it's just really, really important. And then there's the physical part, which you go through yourself. I just want to make sure we get to Allison's activity on the next slide.
I love Taylor's visuals that you added, or maybe Jamie, or maybe both of y'all. I don't remember, but I just love the art that y'all have on the presentation. So another assignment that can be helpful with the journey, with exploration, with what gets to peace is this body story. It can be art, it can be written out. These are all in your slides. So you can basically like, what are the messages you receive, what your concept growing up, how that was shifted and shaped and all that, and then your current, and then what it would look like. And that is where we talk about body trust. A lot of y'all commented, it looks like peace. It looks like the body can do what it needs to do, and I'm at peace with this. And so what would that look like? And there's another slide where I talk about more about the peace part, but just real quick, it's like there might be grief work needed. In I had this body, this privilege, and now I don't. So grief work related to that, to get to peace, But yeah, but this one's a cool one for all clients, I think, and it can be artsy, if your client likes artsy things.
And then here, I think I like, again, the graphic here in that really doing this work and that review of a relationship with the body in the trans community is, it's really about what that person feels, not what you see, because it's so, what people see is so subjective, and what they feel on the inside is really what is a matters. And so acceptance versus tolerance, like, does it have to be either or? Can there be a little bit of both? Like, and what does that mean for that client? So, what does recovery really look like for that client, and defining that through that health at every size lens, which is going to be super important. And as a cis provider, sitting with maybe some discomfort around that might be, important, um, and something to kind of think about.
So a lot of agendas assignments that can also be used, and I use with clients. I'm big on values, little ACT work if you're into that thing. I'm big on the values, and are we living by our values, and do our actions line up with our values? And so what are our values related to gender? What are our values related to gender identity and gender expression? And this is what's important to me, right? And where did they come from? Are these authentic to ourselves? So I'll love that values. I love values work, obviously. And then describe your concept of a man, describe your concept of woman, describe your concept of non-binary, however you identify. Describe that, and where did that come from, right? Because again, there's that like idealized version, or what feels authentic to you. Is that the same? Does that go against your values? So I love all these. And no, that's it. Because I want to leave questions for Q&A, but there's so many things. So, but you have my email and all of our emails if you need anything. So.
Thank you very much for such an amazing presentation. We do have some questions. If anybody has questions, if you want to drop it in the chat, please feel free to do so. But I do have a couple of questions that came up that we can share. Okay, so for the presenters, what resources might exist for gender expansive clinicians working with eating disorder clients to do their own work around this topic in order to better serve their clients?
I feel like Taylor, that's all you.
Okay.
Or no?
Yep. I think definitely doing things like this and really connecting with the community. I mean, being an ally it's a verb, not a noun. So doing the work in terms of attending this, and there's another one tomorrow. Jamie Dannenberg and Scout, I can't remember Scout's last name, I was doing another one tomorrow, so attending that one. And Silverstein, thank you, Lauren. And doing just kind of immersing yourself, like really familiarizing yourself with like WPATH, any other like community events, like, and it doesn't have to be eating disorder related. It can, work to translate that, and just be familiar with trans folks, the issues that, we deal with. And TFED, Trans Folks Fighting Eating Disorders, is another really, really awesome organization to get involved with as well. And then supervision. I can't stress that enough, is really, really important. Yeah.
Thank you, Taylor. Another question that we have is, if anyone has specific info about working with veterans within this population, I'd love to know more. I'm hoping to have, let's see here. Yes, okay, that's the question. So does anybody have info about working with veterans within this population?
Yes.
Yeah, Taylor does. Great.
No, go for it.
No, I don't. I was just saying I don't. I feel like there are two specialties. One, working with veterans, and so I would have to consult a specialist who works with veterans, and then I would have to consult, like a gender identity specialist, and then combine the two. Because if I had a veteran client, I don't know anything. I mean, I know a little bit, but you know what I mean. Yeah, I don't know. Taylor, Jamie.
Yeah, I just had a friend who worked with trans vets out in Kansas, in Leavenworth, Kansas, of all places. So I'm happy to put you in touch with them if you want. So.
Thank you. All right, we have 2 more questions here and a little bit of time. Are there standards for estimating IBW and KCAL needs for transitioning people?
That I'm aware of, like, as far as like put out there, nothing that I've read through WPATH. However, what I do, I don't do so much at outpatient, but when I was doing higher levels of care, like I've created my own Excel document, and then having, just the standard like equations that we do for everything. And then, you have male, female, and then just with where they are in transition with hormonally, physically, adapting it, like literally kind of percentage based on that, is kind of how I do it, or did it at higher level of care. Yeah, so I wish that I could give you a hard, concrete answer, but that's something I've been kind of thinking about doing more of like training on, because I know that's a question that to get a lot.
Mandy, if
Right.
you'll make a note, we can send, I believe Tammy Beasley / IADEP people things made I'm not a dietitian, so please forgive me for the language I use, a generic guideline. I don't know, but we'll check with Tammy in the IADEP world, because I vaguely remember some sort of dietitian thing about this.
Okay, perfect. Thank you. We have one question here that says, I would love to learn more about alternative language to provide when getting to know clients' preferences. Examples, where do you prefer chest or breast? Do you prefer menstrual cycle or time of bleeding? Are there other ones that feel important for you all to share? And of course, asking what language feels affirming.
Ooh. Nice question. I don't know. Generically, Taylor and Jamie, y'all do more medical things than I do. I would stick to medical terms. I don't know if that's helpful or not. Actually, I'm just going to stop talking because the dietitians are the experts on this one.
Yeah, I think I let it like client led and use that trauma informed approach and say, is it okay if I use this, or is there another term you prefer? And I think it helps being a trans provider, which I know is not helpful for those who are not, and saying, I know that, this can be triggering and difficult to talk about. So please let me know like what, would be more comfortable for you. If it's too anxiety inducing, you can always like take a break and come back to it. Because sometimes I find those like hard and cold medical terms can be a little bit much. I know personally, I kind of sometimes hate them, and I'm a dietitian saying that. So, yeah, that's really approaching with that kind of a perspective.
All right, and then last question. Thank you so much, Taylor. And then this is the last question before we hit our time. But are there resources for transgender GNC youth who may not have parents who are accepting, willing to provide consent for their child to start HRT, purchase a binder, etc.?
That's a tough one. That's a really, really tough one. And I think that I don't have a whole lot of experience with that, honestly. But navigating that, I feel like is more case by case basis. And I don't know, like legally, like it seems to vary state by state. So yeah, I I know there were some folks that had dropped stuff in the chat with that.
Mandy, was that the adolescent question?
Yes.
Okay, sorry, Taylor, I didn't know what she was saying. Real quick, adolescence, yes, tricky, legally, state by state, all these things. And well, my first thought is safety, suicidal ideation. So, so establish that, and not to be like, let's not worry about these things just yet, but like that is first and foremost, especially with our adolescent clients. Also, I don't work with a lot of adolescents. And so I would establish that first. And then the connection piece, I think, is so important. Connect that adolescent with adolescents in that same boat, adolescents who identifies gender non-conforming, what have you. And so they can feel supported and not alone. And then work on, it's so cliche, but here we go, because I have 30 seconds. Work on hope. What will it look like when you're an adult? How can we prepare for this thing? I need all that stuff. But first and foremost with our adolescents, I would do safety and connection. Also just call us and maybe we can figure out something together.
Thank you all so much for taking the time to join us today. Thank you to our presenters for an amazing presentation. All of you who put comments, questions in the chat box, that we will be replying back with any resources that we do have, handouts, copy of the presentation, and the recording. So appreciate you. Thank you so much. And we look forward to seeing you all sometime soon.
Bye, everybody. Thanks so much.
Thank you so much.
Okay. I don't even know who attended. .com.